All right, back to healthy living. We told you earlier the importance of gratitude. Now we're going to remind you about that sleep. That's right. Feel free to press snooze and listen to this. Poor sleep in your 30s and 40s linked to faster brain aging later in life. That's according to a new study from the University of California, San Francisco. And joining me now to talk about this, Dr. Reena Mehta from Uptown Allergy and Asthma. Thank you so much for talking about this.
Thank you for having me.
Yeah, absolutely. So we're kind of giggling because we're both in our 40s. We're talking about the need to improve sleep. What is it that this study taught us? We're always talking about it, but they actually looked at the brain matter.
Absolutely. So this was a study recently published in the journal Neurology, where they looked at close to 600 people in their 40s.
Okay.
And they basically said, okay, they ranked their characteristics of sleep. So they did a survey and they said, how do you sleep? Do you go to bed too late? Do you wake up often in the middle of the night? Do you feel rested the next day? Are you very tired? Do you feel fatigued all the time? And they basically ranked their sleep quality.
Yep.
And then 15 years later, they did an MRIs of all of these patients, of their brain, and they basically found that the ones that had poor sleep quality had increased brain age by 1.6 to 2.6 years than normal. So basically it shows that poor sleep quality in your 40s can actually lead to neurocognitive dysfunction in your 50s and 60s.
Okay, let that sit for a second, you guys. Just let it sit for a second. Can you undo damage? Can you slow the clock by changing your habits now?
Absolutely. So that's why we're bringing focus to this right now. The thought is that in our 40s, in our midlife, which both of us are, if we can improve our sleep quality now, it will have added benefit in the future. We all know that sleep is so important for functionality of your day, but also important to reduce inflammation, to prevent cancer, to have a healthy lifestyle. And also if it prevents things like dementia and neurocognitive decline, that's very important to focus on now so that we can be preventative later in life.
And this is so important, Dr. Mehta, because you're in the allergy asthma realm as well. You know what it does to people when they can finally breathe. What are some things that you should get attention and hopefully a diagnosis to help you sleep better?
Yeah, so that's great. So focusing on good sleep quality. So things that could be helpful is going to bed the same time every night, trying to sleep in a cooler room. Okay, the studies have shown that that can be helpful. Limiting light when you are sleeping. Okay, avoiding things like excess caffeine, nicotine, alcohol right before you go to bed.
Okay.
Having a good sleep schedule. So you go to bed at the same time, you wake up the same time. Relaxation techniques can be very, very helpful before you go to sleep.
Okay.
So things like that, exercising consistently every day during the day, 30 minutes of moderate exercise daily can actually improve your sleep. So, you know, easier said than done, of course. When you're in your 40s, you're in the grind, you know, working, kids, all of those things.
Right.
But if you just take a little bit of time to put an emphasis on that good sleep quality, there are lots of added benefits later in life.
This is also important right now, especially since this is the age that is caregiving up and caregiving down.
Exactly.
Right? So
the sandwich generation, is that what we call it?
Oh, there we go. Something. It's something. It's the tired generation.
But if you have trouble sleeping or knowing where to start, there are doctors and providers that can help you with this. So there are sleep medicine specialists that you can go to that can help stratify your quality of sleep and give you techniques on how to improve it.
It's worth it. Dr. Mehta, thank you so much for your time today.
Thank you so much for having me.
Really valuable info.